Great, good morning, everyone. I think the only thing worse than trying to follow Mr. Chen is trying to follow Ms. Richards, so wish me a little bit of luck. Let me sort of assume all protocols observed. It's such a delight and a distinguished pleasure and honor to be with such a great group today. Unfortunately, I was not able to be here yesterday. I've heard about the rich and robust conversations that you've had, and based on this morning, I can understand why. Let me begin by first congratulating Jamaica. For those of us in the health field, the ceremony yesterday marking Jamaica as having successfully and completely eliminated mother-to-child transmission of HIV was a rare and distinguished honor. So again, well done to everybody, all of you in the room and those online for the support and the engagement and the effort it takes to get to that certification. It is unfortunately still quite rare in the world, so Jamaica is once again a leader. Let me also congratulate all of you and Ms. Carnegie for organizing this conference. I'm thrilled with some of the themes which I will touch on from USAID's perspective, but I think of all of you as positive disruptors, which brings into mind the old saying that if we keep doing the same things over and over again and expecting a different result, then the fool pity us, right? The error is on us. I'm thrilled with the comments about the whole of approach, right? Whole of society, whole of community, whole of government. And it's something that certainly the US government and USAID are committed to, working with the private sector, working with NGOs and CSOs, working with communities, and of course, government counterparts, whether they're national counterparts, regional platforms, international counterparts. It will take all of us bringing our collective skills and efforts to change some of these intractable problems. I'm thrilled to see mental health getting a higher profile on the global stage, not only just from the healthcare providers, but what it means to educators, what it means to school outcomes, what it means to crime and violence, what it means to being able to maintain employment. I think it's a well-deserved and a very positive shift for all of us. And certainly USAID is looking for ways to increase its partnership, to reduce stigma, to build access to quality of care, and strengthen health systems. I think healthcare innovations, whether it is task shifting, whether it is reimagining how we recruit and retain qualified providers, whether it is through the use of medical technology, I think is, whether we like it or not, something that is happening, and we will need to figure out how to best harness those potentials and those opportunities. How do we foster creativity and collaboration and entrepreneurship to really address these complex health challenges? There has been a big global push. Mr. Chen talked about the impact of COVID on communities in Jamaica. And let's not forget that it impacted Jamaica's economy and the global economy and global commerce and global trade that we're still trying to come out of. So I think figuring out how we make strategic investments, partnerships, and others to not have to fall into this repeated pattern of panic and then ignore will be important for all of us. And I applaud Jamaica's leadership in this area. And then lastly, certainly healthcare infrastructure, whether it is a community health center, whether it is Kingston Public Hospital. I think, investing in built for purpose infrastructure that can meet the needs of the patients, and so that we can get back to the root of public health and treat patients as a person and not as a disease category that then we have to figure out how to triage and how to send them to chase different care and manage different prescriptions. So again, I think that information systems, supply chains, equipment, emergency preparedness, all of these things will continue to be priorities for our partnership, not only with Jamaica, but with other countries around the world. And then certainly we at USAID, and I'm again pleased to learn from the discussions here today, are looking at how we look at the system approach, right? We have programs that address youth crime and violence prevention. We recently launched a program that works to support victims of violence. What we are trying to do internally is also then link those investments with community security and youth violence prevention with our health interventions, right? Because we often are guilty of treating a young person who's in school this way, and then a healthcare worker this way, and and we overwhelm our government counterparts by coming at them in multiple different ways, rather than saying, how can we work collectively, collaboratively, and address the issue as a systemic issue. So my tremendous congratulations once again for all of you, for Jamaica, for continuing to be a leader in this area. I look forward to the discussions, and I wish you great success today. Thank you so much.